we are going to share what we found. We assessed 21 employees with a male to female ratio of 2 in favor of male, ranging, their age was 30 to 55. We are not surprised because it's a working class. As concerned the workplace, all participants primarily use computers at Site Savers, and almost all of them have computers. What do they do when they have to position the screens? We found that 90.5% directly work we have the computer in front of them, while 33.3% have it less than 60% away from their faces, and another 23.8% position it higher to their face. The various positioning of the computer screen, some at user sides, the others are at the eye level, exposes employees to potential discomfort, including neck, shoulder, lower back, and wrist pain. And these are well-known science complications from the CVS syndrome. Concerning the distance at which the screen distances and height leading to discomfort is, we should know that when you put your computer less than 60 centimeters away from you, the CVS syndrome is on the way. The distance between the users and the screen depends on the size of the screen, and it is preferable to sit at a distance equal to 1.5 or 2 times the diagonal of screen in front of you. So like you have to calculate when you're trying to design the ergonomics of your room. You should know the size of your computer, you should know where you're sitting, and design where you're supposed to sit. So these are things that could not be done just hazardously. That's what we noticed when we went to Site Savers. Despite the fact that Site Savers is also involved in eye care, the rooms or the workplace was not totally in favor with a protection of the eye or eye hygiene of their employees. It was the same with how do they break their eyes, how do they protect their eyes. We all learned about the 2020 rules, which was discussed in length during the World Sight Day this year. All the offices at Site Savers have air conditioning, and they have adequate lighting. But the curtains in the office and the air conditioning are not well positioned compared to where the employees are sitting. So it is important to note that air conditioning tends to dry out the ambient air, which in turn contributes to dry eyes, which we are discussing in this Congress, especially when the air conditioning is placed directly in front of the user. So 30% of the employees position their computers facing the window, or they sat with their back to the window, allowing direct light to fall on the computer screen, which was not the best. Another 20% did not use face shield on the computer screen. 85.7%, which was 18 participants, incorporated eye breaks when working on the screen. The other were less than 20 minutes when they had to break. Prolonged computer use or work can lead to visual fatigue, and it is advisable to use the 2020 rule. Take breaks every 20 minutes by looking at something away, far, to relax the eye muscles. It's same for the shade fields, the face shield that is supposed to protect us from all the UV lights coming from the computer. What about the ocular finding? The main complaint of the employees was glare, ocular itching, reduced distance vision, tearing, and eye redness. We also found that 95.2% showed useful visual acuity, but we were surprised because one of the employees did not have any consultation before, and we found it to have an uncorrected refractive error, and another one we found to have a red-green axis dyschromatopsia. And before the event, they never knew that they had a problem, and they worked by site savers. What did we find again? 90% of the participants had never been to an ophthalmologist, despite the fact that their sponsor ophthalmology activities and save people's eyes, themselves had the opportunity to have the eyes checked during that event. The prevalence of ocular pathologies among the workplace or people or employees is the same like in the general population wherever they are working. So we really have to enhance the comfort of the workers by going towards them during events like World Sight Day. What did we learn from this experience? At Site Savers, the workplace is spatially adequate with necessary material and equipment available. However, it requires reorganization and protective measures for computers to comply with the norms and safeguard employees' eyes at the workplace. However, we advocate for ergonomics practice at work and recommend raising awareness on eye hygiene and regular eye exam for the staff. We advocate for activities during World Sight Day, and we also please share whatever you have found or you have had. It's another way of advocating. These are some pictures of the event. We thank you for listening.
Thank you, Prof. Ipe. Thank you for those findings. We've been shared with site savers. We are lucky to have them in the room. And we just want to highlight the fact that there was probably an issue with gender considerations. At site savers, the ergonomics and the ocular findings are that they will take that into consideration. Without wasting most of your time, we are going to proceed with the presentation from Dr. Oye, who is going to talk about mettre fin à la perte de la vue évitable 2030 in sight.